move on to the presentation. Ami, Alex said, for your presentation, Ami will do the presentation, and after which we'll have the World Bank TTL coming in, and also UNICEF will come in as well, and then we'll discuss the issue of the catch-up campaign and the routine services. Good morning, our DPS. Good morning, the delegates from Cameroon, WCC, and then our Honorable PS, World Bank, Dr. Mills, and my fellow colleagues. Good morning to you all. My name is Amidiba. I will be giving this presentation on behalf of the registrar on the mass registration that was conducted from the 1st of August to 2022 to February 2023. Before going on to the presentation, I would like to give a little background of the CRVS before, that is the birth registration before we come into the CRVS. Birth registration started since 1880s, and then it was during the colonial time where the colonial masters used to register their servants and then their people walking around them. So when they left in the 1880s, we became a republic. The president came up with the initiation of doing registration for all citizens of the country. During 1997, we saw that the need is there to decentralize to some of the regions and then allow other Gambians to have access to this registration. In 2004, we also integrated it into the RCH, which is the reproductive and child health, where we realized that the kids have access to attend the immunization, at the same time have the chance to do the registration for birth. So alongside, we also came up with some other plan where we have registration, mini campaign conducted to at least reach those that were far from the registration centers. In 2018, the World Bank and other partners came in to do a comprehensive assessment to see, because we realized that despite those ways of trying to attract people to come for the registration, we realized there were some challenges in record keeping. We were using the manual system, which was a paper-based, where the officer will have to write on the paper and then record it on the main registers. So we have difficulties of keeping those registration records, archiving it into a long-term process. So in that sense, with the support of the World Bank, we came to realize that there is need to put this into a system where it will last long. And then not only the registration staffs realized the need, because it was tedious. You have to be writing a lot of parts for this registration. So when we realized that, we came up with the new system, which is the electronic birth registration with the help of the World Bank. And then we would like to go through to show you how we came up to get to where we are. My presentation outline is indicating the following. That is the campaign preparation, how we prepare for the campaign, the local government engagement, the media, the logistics, the team composition, the operation, coordination, monitoring, the lessons we learned, the routine services, the challenges, the achievements, and UNICEF catch-up campaign that we recently concluded. The campaign process took many directions in the sense that we have a lot of assessment that we did in order to plan for this mass registration. The first assessment that we did was to look for registration sites. The other one was also to assess the internet, because the new agenda was to put it in the electronic form. And for that one, it would require internet services. So we also did an assessment on the internet services. We did assessment on the registration site, which we adopted from the Voters Registration Center. We have the the IEC. The IEC, they have been conducting nationwide voting registration, and they've been handling it very well. We engaged them, and then we saw that the way they were doing it was really wonderful. So we adopted some of their sites, because some of those sites were highly recognized by the public. So the other engagement was the stakeholder, because if you look at CRVS, it's not only about the birth registry or the Minister of Health. It encompasses other stakeholders which are very key, like the Minister of Interior, and then you have the local government, the IEC, and then the GPOS. These were key in the planning, because we learned lessons also alongside, especially the IEC, on how they were conducting this.
When you look at the dashboard, you're able to see the total number of registrations that have been done. And you can also, so we have 1.2 million that has been registered now. During Ami's presentation, she mentioned that during the mass registration, 1.1 million was registered. And you can always check. So for example, the last 15 minutes, you have 30 registrations that have been done. You can choose in the last 1 hour how many has been done, the last 7 days how many registrations have been done. So you can easily see how many registrations. You can also choose from one period to another. You can also disaggregate the data by local government areas or by region. So you can also disaggregate and see which regions are performing well, which ones are performing less. These are the registration by settlement or villages, so to say. So you can see the number of registrations by settlement as well. This is by region. And then if you are interested in the disaggregation by male, the sex ratio, you can see here that we consistently throughout the registration, we found out that there were more females registered than males. So it was consistent throughout the campaign. Even after the campaign, it still remains so. You can also see the number of registrations by age. So these are the under one. How many children have been registered under one? 1 to 5 years, that's 1 to 4 years.
Of course, as Dr. Mills has just said, this exposes them to a host of abuse and exploitation, such as the child marriage, trafficking, but also it has the potential of depriving them of basic services that are needed, like healthcare, education that you just mentioned in the case of Cameroon. So we are happy to be here because we also consider that our objectives are aligned with that of the partners, that is the World Bank and the Ministry of Justice and the Ministry of Health. The objective is to have the goal of having universal coverage of birth registration, which is why we have been very much interested in the interoperability that Dr. Mills has mentioned. Although on the other side, the interoperability that we have mostly been focused on has been that of birth registration and other health services in the country, such as the immunization and the maternity unit, which is why in Ami's presentation, which has been very detailed, she has mentioned one of the first things that we looked into when the digitalization came into effect was an SOP that would really strengthen the interoperability between the birth registration and other health services. Because in that regard, we would ensure that no child is left behind. Because if you look at, like Dr. Mills said, the rate of delivery of children in the hospitals in the Gambia, which is over 90%, we deem it necessary to support the strengthening of these two units, because once we are able to catch all these children who are born in the maternity unit and register them, then the rest of the 10%, which is the rest of the children, which is the 10%, can also be captured in the immunization. So in the long run, this will ensure that everyone will be registered, and that is the universal coverage that we aim to achieve. Now, when it comes to UNICEF, our focus areas when it comes to the registration are three. The first one is when creating the enabling environment, which is currently being done to strengthen the system through the bills with the support of World Bank, of course. But also we are looking into transforming the routine, and that is where the interoperability comes into place. And but thirdly, we also work with other partners, because we are also looking to mobilize communities to demand for the services. Because when we talk about the birth registration, it has two aspects of it. You have the services being in place, but we also have the demand from the community side, which is also the reason why we work with other partners such as the Department of Community Development. We work with the National Civil Council, the Child Protection Alliance, and other agencies that help us mobilize the communities to demand for these services. And in that way, we will ensure that the services are available, but at the same time, the demand and the awareness is there for these services to be sought. So I wouldn't give a presentation, because Anna's presentation was detailed enough, and she didn't only touch on the mass registration, but the challenges and the achievements that have been made in the birth registration in general. So I will just join the colleagues to welcome you once again. And I'm certain that the lessons learned, if contextualized, it will be very beneficial for Cameroon, and we wish you all the best.
Thank you very much, Ami, and thank you, DPS, our colleagues from Cameroon, TTL, we welcome everybody. We met some of the questions raised. We try to dwell on them as possible. The first one was the standard operating procedure. This is a document that guides in the equation of anything that you want to do. It's sort of ideas put together technically that the service providers can use to facilitate their work. That's what we mean standard operating procedures. Regards to the number of registration centers, we use the independent election sites initially, but when we learned that our service need beyond electoral independent services, our operations, we had 300 teams. These 300 teams, we divided them into 56 clusters. So we moved the teams in terms of 56 to areas, not only by the independent side. So we moved them according to the geographical areas where these can be positioned for a specific period, then we move them again to another site. That's the way we do the whole country. So our limitation of the site is, we cannot say we have this number of sites, we have beyond counting of those sites. We just look all the geographical areas, approximately 2 kilometers away or a few meters away or about 500 meters, that a team will be positioned and they will do a registration for a number of days. For example, if you take a cluster a ward, we divide this ward into 56 clusters, and we're able to post the team there, they will be there for 2 days, then we move it. That's the way we were operating. And in that duration, as you were mentioning, how long was the registration took place? Our registration campaign was 7 months, from August to February, August 2022 to February 2023. How do births at home, we register births at home because our system is such a way that a birth that occurs at home, you come and join the clinic. There's what we call infant welfare clinic, where children are enrolled and the mothers are enrolled. So you start from the antenatal, even the delivery has not occurred at the facility. You have the opportunity to come back again to renew and give the child a document that we call infant welfare card. that will be for the child, with the child for the 5 years, where the child's immunization, the weight, and the good monitoring, the health monitoring is done, and any other health needs the child may. This certificate, that document is where we incorporated a portion on it for registration to be recorded and also be captured. So if you register at home, you must come to the clinic to acquire this document. It's free of charge. And then it's given to mothers based on the clinic days. Those who are facility based there, they will give it to them. Those who are far away from the facility, right, 5 kilometers away, there are clinics that we call outreaches. The health team will move to those areas and provide the services on a regular basis in the month. For example, if your area is given a second week of the month, every second week of the month, the team will come, the health team will come to that site. And it serves as a conversion zone for the closer villages to come and then be in that area for services. So that's why we capture them. And then they are also on board as any other delivery at the health facility level.
It's always important to double check everything. I can also view the facial image, which has, for example, been taken at one of the registrar centers to check if this is the correct person. And once I am happy with the mother's tab, I can move to the father's tab. I will demonstrate one of the workflow validation rules. So if I choose a female for the father, then I will get this sort of validation rule that the father must be male. And again, I have pre-registered the father before to make it a bit quicker registration. So John Mendy, I can check his unique identification number, and this is the person who I'm looking for. I can check the date of birth. And if I'm happy that this is the correct person, then I can select, and all the data elements again will auto-populate. The event tab, it's always sort of called the event, either in birth, death, marriage, or divorce, is to capture the details of the life event. So in this case, it's the event of the birth. So I can click date of birth. So for example, yesterday, time of birth. Yes, I can choose the type of birth, so single, twin, and so on. In this case, I will choose single. Child order number, I believe this is for Laos. Okay. Oh. So in order, in the family order numbers. Actually second, because I pre-registered the sister before as well. Location of birth, so it can be in a hospital or home. If I choose the hospital, the forms are usually dynamic, so there will be additional fields appearing depending on my choices. So here I have the health facility name, and we have a sort of a taxonomy behind this. We have all the names of the hospitals ingested, and by typing I have some options already. Let's just choose this one, this clinic, and also because of this choice of the facility name, the system understands where the facility name is as well, the address of the facility. So it's auto-populated here as well. We have birth attendant details. So this section is important if, for example, mother or father have been not known. So attendant details can be entered here. So for example, for a nurse or doctor or someone else, I will click as in not known. So this section is grayed out and I do not have to enter it. And then we come to the contact details. So someone who needs to be informed to collect, for example, a birth certificate to come to the registration place. So here I will choose a mother, and then as you saw, the whole section collapsed because the mother's details are already pre-entered, and all I need to enter is just the phone number. Once everything is entered completely. The 3 ticks are green, and the blue button now lights up, and I can submit a notification. If there would be any other validation rules, they will appear after I confirm that something is incorrect, but I am confident right now that I entered everything correctly, so I can submit the birth notification. And it tells me that notification has been successfully created. For Tom 2024, I can close this notification. So notification does not appear in the task list, but it appears in the backend, and it can be used for further declarations and registrations.
And we know that this is a preventive approach to deal with that situation, but the current also stock of population who are not accessed are very impacted because they are not allowed to participate in examination, and they are also dropping out from schools. So, and this is something that the education sector, in collaboration with UNICEF and other UN partners, are trying to look at. So, and at the country level, we have almost 8 million person without birth certificate, and some of those persons will not participate in their civil activities, meaning that the identity card, etc. But for the education sector, we are doubly concerned because the learning poverty in Cameroon is very high, and the quality of education also is really a big matter. So that's why we think if we should find a way to deal with this, it will be impactful. It would be very helpful for the country. And we have heard that Gambia, you have the massive registration activities that took place some months or years ago, and it's considered in the bank as the best practices, giving the birth certificate or registration to a broader the range of people in a very timely manner. So is very transformative. So that's why we came to learn about that process and to really understand how this could inspire our colleague client in Cameroon, and so to see what kind of collaboration also we can have to continue to support on that side.
We've been doing registration for a while now. We started with the campaign 2022, the electronic bar registration. And then after the campaign, we started in the facility. We do register various categories. And now that the notification issue is coming in play, it's going to be very essential and helpful for the population to be registered at early age. And right now we've set up some of our materials, and we want to show you how we're going on with the registration. Right now we are prepared there, and the materials are all set up. Yes.
500,000 children without birth certificates in the system. And the Cameroon, the world population is about 25, 30 millions, and we have a real problem for the continuation of the, the education. So now we receive the help from the World Bank to carry out this important operation of giving less 200,000 birth certificates of those children whom are in the class 6. This is very important, and we have to carry out this operation in the few.
From what you're doing and see how we can adapt it to the Cameroonian system so that in a short while, between now and June, as he said, we are able to do something for these children so that they are able to participate in the national exams. That's basically why we're here. So we're here to learn from what you've done.
I discovered that the legal system is different. Yes, of delivering birth certificate in Cameroon is very different with the system that is applied here in Gambia. Yes, it's very different. And we know that in Cameroon we have many administration involved in the legal system. But here we have only one administration, one ministry. Two, the health and education. Justice. Justice is concerned only for marriage. And that is that's one.
Gambia, we want to ensure that, inshallah, we want to ensure that everyone is registered. Because that helps us in planning. That helps us in knowing the age categories. In fact, in our discussion with the Ministry of Education, because they want to ensure that every child in Gambia is educated. But how do they do that if they do not know the database? They don't have the database. So they assume that they've had 98% coverage or 90% or 80%, but that's just an assumption. But by the fact that if people have birth certificates and they know the age ranges, all the school-going children, how many of those are in school, then they can now go and scout for the people who are not in school to bring them into school. So you see how beneficial it is for the Ministry of Education. And so our teams have been working together, but the Education Minister and myself, we want to even strengthen that position so that we work together very, very closely and share information so that there are people who go to scout for people to go to school are able to do that very well. So in summary, these are very important steps, but the advocacy, the political commitment, very important, the messaging, getting the people to understand and then reach them where they are.
We came here to learn from Gambian experience of registration. We have a lot of problem. We have more than 1,500,000 children without birth certificates. So, and the Honorable Minister of Basic Education want to launch an urgent operation to give a birth certificate for children attempted exams. So I will give the Mr. Low to give what we saw here in Gambia.
We were interested in learning how Gambia delivered the massive registration campaign in a very timely manner. So, and providing also birth certificate, registering many population, and what is the legal framework and how also the collaboration within various ministers have been done, and what kind of also challenge they were facing in doing that. You know that it's easy. So because it involves many stakeholders working together. So and I think that just to give you a sense of what we have done, I think that we visited some health facilities and we meet with really various stakeholders, and we really appreciate how the leadership from the Ministry of Health was important to make this whole aspect working.
We think that as a department that takes care of education, um, these children need to be reinserted into the system. And so the minister has actually launched a period where between now and June, when the children will be writing their exams, we should try to get a solution for all the children who don't have birth certificates. And we think that the experience in Gambia is a very rich one. They've been able to cover a good number of kids in a very short time. And we think that it is a very good experience that we would use to be able to reason about how to answer to the needs of these children in Cameroon.
I don't have something else to say. The speech given by Mr. Law is very concrete. It summarizes the situation that we saw in the field. The situation concerning Cameroon, the experience that we noted here in Gambia. So I noted the procedures is very flexible, and the services is brought to the population by the administrator. That's very good, and the fees concerning that procedure are very low. That's very good. What I can say, very rich experience that we can implement.
I want to say thank you to the Honorable Minister, the Deputy Permanent Secretary. The Permanent Secretary also joined the first day of the session along with Mr. Fati and his team. And we thank you for the hospitality and for making arrangements to host our colleagues at very short notice. We really appreciate it. How did this come about? The regional vice president's office, they looked at all the projects that are in the region across all sectors, and they selected the health project as one of the most transformative projects in the system. So when I went to Washington in November, I had a meeting and they said, well, can you make a presentation on the project? So we made that presentation last month. And during the presentation, I realized the focus was on the mass registration. People were very keen on the mass registration. How could you have done that in a short period? Immediately after the meeting, my good friend Mustafa said to me, "An email, Sam, I want to know more about Gambia. We consider a study tour." And I said, well, we'll see whether that's possible. So I contacted him.